It's good to see everybody here tonight. Nobody's trying to rob the stage, but we're all equipped, it looks like. Thank you for making the effort to be here. Always a pleasure to have a large crowd, and we look forward to the time when we can be more in a standard sort of mode of operation and accept more people in here at one time. If you do have an electronic device that makes noise, please silence it at this time. We're happy to welcome tonight for our invocation Reverend Colston Morris, who has two churches in his charge, Salem United Methodist, and that's right down the road near Chinquapin, and St. John's United Methodist in Eden. And after he renders our invocation, I'm going to ask Commissioner Berger if he would lead our Pledge of Allegiance. And with that, if you would all stand, and if you come forth, Reverend, we'd appreciate it.
Mr. Commissioner, thank you tonight for inviting me to be a part of this meeting. Let us pray. And Jennifer, thank you. God, we thank you this evening. We have come from all walks of life. We have come to share together, dwell together, and share the goodness of this community as we come and be a part of this community, Lord. At this hour, we present everything that will be done here this evening. It is only you that can give us the courage, the desire to do your will. We thank you for Rockingham County, and we thank you for this unique community that you have brought us to live in. At this hour we come, that whatever will be discussed here, Lord, your Holy Spirit will guide us in the process. We thank you. We bless you now. In Jesus' name we pray. Amen.
Amen. Face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And thank you again, Reverend Morris, for giving up your time and providing that invocation. Gentlemen, you've had the agenda, and there have been some proposed adjustments to it, but our first order of business under item 4 is approval of this agenda for the evening. Do I have any motions concerning that agenda?
Mr. Chairman, I'd like to move that we adjust the agenda by removing item number 11, and under new business, we add Board of Elections appropriate CARES Act funding in the amount of $138,064 and HAVA funds in the amount of $23,100 from the state for increased costs expected to be incurred by the election department during the pandemic, COVID-19. No matching funds are required. In addition to that item, I'd also like to add closed session pursuant to NCGS 143-318-11A1, approved closed session minutes, A3, consult attorney, A4, location of expansion of industries, A5, instruct negotiating agents, A6, discuss personnel.
Motion made. Do we have a second? Second. Seconded. Further discussion? Hearing none, all in favor indicate by saying aye. 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 Those opposed by nay. The agenda is passed. One of my favorite things is to recognize citizens of Rockingham County, and we will have two sets, but we're going to start with, I don't believe Kevin Taylor's here tonight, but Max Dooley and Catherine Seaver. If you guys would come forth, we would appreciate that. You want us all, or you going to take care of this? He's got it. Right over here. We'll keep our distance there, and you'll have a chance to speak if you so desire. But these folks have worked very diligently and have made major contributions. And I'm going to ask Michael Roach if he would explain what they've done for us during this period of COVID-19.
Well, besides a little magic, what they've been doing is they've been printing a lot of 3D stuff in their 3D printers. And some of it is just with these things like here, which I'm wearing a bag, is an extender, so it keeps the thing behind you, going behind your ears. They put it so it's behind your neck and not as much strain on your ear. The other thing they've printed a lot of is these hard plastic things, so when you wear it, you got a face shield. And the other thing they've been doing is printing a lot of these little tiny things blue, and this pink one over here is for a different type. This one here, if y'all wear a ball cap and everything, it keeps it away from your face a little further, better, and it makes it a little easier to breathe. And the things that hold that onto your hat are these little tiny blue things here, and they print this on a 3D printer as well, and it just screws in to hold the plastic to your face. And then you can cut the plastic any way you want. Now, one of the things when we first did this, they had printed about 500. I believe the number's now up to 624. And they've been
Just
given...
the face shield.
Huh?
Just the face shield. The actual hard plastic face shield.
Yeah.
We've done probably about, I know I've done at least 55 of the hat flips.
Hat flips. And they're not charging for these, they're free. We just give them away. And lots that have gone to the county, EMS units, some other types of doctors' offices and things like that. Health department is another major recipient of these. So they've really done a lot of work, and I appreciate it. And it wasn't my idea, it was her idea to start printing these things. So the praise also goes to her, not to me. And Max here was helping with them and everything like that. And unfortunately, Kevin from the city of Eden, he wasn't able to come tonight. So he's done a lot of work too for us. So I'll turn it back to you, Brett.
Well, we thank you. Yet another confirmation that I'm ignorant with IT. Certainly, I'm lucky to get a sheet of paper out of my printer, much less something as functional as it. And to you folks, we give you thanks, and we have something to, a letter of appreciation. And Mike, I believe we have one for you to take to the third party. And if you guys would, I do have one more thing for you, and that being a small pen to remind you that you're in a good place for the county. And if you have a chance
All right, thank you.
to go past the opportunity.
Appreciate your help.
Yeah.
Good job. As part of our Volunteer of the Month program, we're going to ask Ann Summers-Fish to come forward, if you would. And Ann, I'm going to give you some room because I want you to talk and get this. All of us that know Ann, particularly veterans, appreciate what she's done. She has not only kept up with us through her church and her individual efforts, she's provided recognition on an annual basis for as long as I can remember for all the veterans, and volunteered in numerous ways. And tonight we'd like to recognize you for your dedication to the community and to the citizens of our county. And we'll be putting your name on our plaque up here as our outstanding volunteer for the month of August. And I'm going to present this to you, and also a reminder that you're in a good place. And thank you very much for showing up tonight. We tried to surprise you, but it was impossible. She's too good a reporter. She does her snooping around. And you have your chance to address the crowd at this time. I wish you would, because then it gets recorded.
I forgot Roy was sitting over there. I appreciate everything, but I couldn't have done anything I've done without all the volunteers that helped me. I mean, I've got people in my church, Church of Jesus Christ of Latter-day Saints, that help me do the food drive every year. And my friend Elwanda Ansel, who's with me tonight, she helped do the Veterans Program for the last several years. Of course, we had to cancel it this year. But I mean, everything I do, I have a good, is the word cadre that I want to use, of people around me doing it. So it's not just me, and this is not just for me, it's for a lot of people in our community. And I appreciate what y'all have done. And if it hadn't been for those gentlemen doing the mask, I may not have found out about it, but I learned about that and I was trying to find out about it. And I said, whoops, there's my name. So, but I appreciate it, and I'm sorry I had to disappoint Mabel so she couldn't surprise me. But thank everyone.
Thank you, Ann.
Thank you.
Gentlemen, you've also had, under item 6, the consent agenda. The consent agenda consists of non-controversial items that are handled on pretty much a routine basis. If you do have a question about them, I'd ask you to refer those to our county manager, Lance Metzler, either now or on the phone, whenever you might. I know of no suggested changes or deletions, additions or deletions to this agenda. Do I have a motion to deal with it?
So moved, Mr. Chairman.
So move for approval from Commissioner Travis and seconded by Commissioner Pirtle. Further discussion? Hearing none, all in favor indicate by saying aye. Aye. Those opposed by nay. Tonight we have no public comment, and we'll move to item 8, where we will have a public hearing. Pat? Mrs. Galloway is going to cover again the refinancing option under this item.
So good evening. At your last meeting on August 3rd, you passed a resolution for us to pursue refinancing certain debt that we can achieve a lower interest rate. That resolution was a not-to-exceed refinancing amount of $6.2 million. We selected J.P. Morgan Chase Bank at a fixed rate not to be more than 1.84% for the tax-exempt portion of our debt and 2.32% of the taxable. And this refinancing will be secured by the DSS building. The estimated savings at that time was $450,000 over the life of the loans. We have final numbers as of the end of last week. We have the final payoff amounts on our existing debt. They've negotiated the closing costs down, so our final refinancing will be $4,628,000, still with J.P. Morgan Chase Bank, at a fixed rate for the for non-callable. The tax-exempt portion is 1.17%. The taxable rate is 1.62%, still secured by the county DSS building, and now our estimated savings over the life of the loan is about $532,000. And we have the final payoff amounts from BB&T Truist, which is holding the debt that we are refinancing, and the closing costs were negotiated down from $120,000 to $75,000. So that's the details of what we're doing. You need to do the public hearing.
And once again, if you had further questions on the details, I'd refer those to you, Pat, or to our county manager. And these numbers agree pretty close to what we covered during our resolution. Do we have a motion covering this refinancing? Wait a minute. Got to do this right. Declare the public hearing open for any comments, questions. And I will confirm nobody has sent in any written questions or comments. I will declare the public hearing closed and reiterate that we would accept motions at this time or questions from the Board of Commissioners.
I'll make a motion to approve the recommendation.
Motion to approve by Commissioner Travis.
Second.
Seconded by Commissioner Berger. Further questions or comments? Hearing none, all in favor indicate by saying aye. Aye. Those opposed by nay. The ayes have it, and we thank you, Mrs. Galloway.
Thank you.
Ms. Carrie Spencer.
Good evening. You have a rezoning case to consider, 2020-17, submitted to us by a Clyde Evans. Mr. Evans wishes to rezone a property just north of Stoneville from residential agricultural to highway commercial conditional. This is a conditional zoning request. The property was operated as a gas station and a grocery store some time ago. It has been vacant or very used for storage, just very little use, and the applicant wishes to rezone it so as to make the property more marketable. So you see where it's located in the aerial of the property. The planning board did vote 6-0 to recommend approval to you. There was very little public comment. And staff recommends approval. Does feel like this is right in the economic development land use class and feels like it's suiting for that area.
Commissioners, do you have any questions before we open the public hearing? Hearing none, I will declare the public hearing open for this individual case regarding property at 10971 US 220 in Stoneville. Is there anyone here that wishes to make comment or address this rezoning? Hearing no desire for comment, I will declare the public hearing closed. And gentlemen, the floor is open to the Board of Commissioners for comment, question, or motion.
Mr. Chairman, I'll make a motion to move forward with the rezoning request and include all statements and analysis.
I'll second.
Okay, we have a motion and a second. Further discussion? Hearing none, all in favor indicate by saying aye.
Aye.
Aye. Those opposed by nay. So, Mr. Evans, didn't even get to talk.
Thank you for coming.
Yes, our friend Reed Thornburg from Cardinal Innovations. Thank you for driving up. How long a drive is it?
For me, it's about 50 minutes.
Yeah. For those of you who are not aware, Reed represents Cardinal Innovations, and as such, our county, which is essential to the financing of many mental health issues and drug issues and so forth within our county. And they have the responsibility for distribution of, I guess, most all the state funds that we do receive for citizens in this county. So, Reed, thank you, and please carry forth and give us an update.
Sure. Chairman, Commissioners, County Administration, Jennifer, thank you for fitting me in. I appreciate it. We're here tonight to give you some updates. You have a PowerPoint presentation that was provided to you by your county manager and clerk, and just want to review that and do some highlights. It doesn't matter, whichever. Give me an iPad and I'm good. But okay, thank you. Appreciate it. Thank you. All right, so I'm going to start with slide 3 where we get to the organizational updates. The Triad Regional Health Council has been developed and has met twice for initial introduction, election of officers, and the framework discussion around addressing the specific health needs of the Triad counties. Rockingham County representatives serving are Mr. Ricky Graves, who I'd like to say voluntarily chose to be chair, but he was nominated and elected, and I think he felt like he had no way out. But no, Ricky's been great to work with us, and certainly has been a staple of representation for our Consumer and Family Advisory Council, as well as some other organizations supporting the community. And then Ms. Felissa Farrell, who you all know is part of the county government here with Social Services and the Health Department. And those meetings are held on a quarterly basis. The next one is August 26th. And so what we'll be looking at are any recommendations from the community advisory councils, as well as in the near future looking at the hospital assessments as well as health department assessments for looking at the healthcare needs of citizens in all of those counties. The recruitment for the Triad Community Advisory Council members for Rockingham County specifically continues. The council seeking emergency responder and local municipality representatives, law enforcement representatives there, and I've got a contact name. If you would pass that along, if you know of anyone interested or want to volunteer someone to participate. Certainly we'd like for everyone to voluntarily choose to be a part of that group, but you've got a contact there, Mr. King Jones at Cardinal. We'd like to hold that as soon as we can, so if we can get a few more folks interested and willing to be a part of that, if you'll let Mr. Jones know. The county dashboard report that is developed and provided to this board and county administration on a quarterly basis is currently under revision. You have certainly you've got the most recent, but just want to let you know that going forward, we've been asked to include, or I've been asked personally to include, and I think it's going to translate over our 4 regions, to include reporting on member hospitalization utilization, as well as service authorization, the various services that we authorize for care under Medicaid and state fundings and authorization information. And a new opportunity that we've sought to really highlight some of the good work that's going on in our communities, Wonder Women Wednesdays. Not to neglect Supermen Saturdays, right, when we do all of our best work, but Wonder Women Wednesdays, we're highlighting really the amazing work that's being organized through organizations and being provided in our local communities by wonderful women. And just so you'll know, the next one will be on September 23rd. It's going to be highlighting Ms. Kathy Simpson, who is the executive director of REMSCO, who addresses substance use needs and health services in the local community. So she'll be highlighted at the next one, and I can send that to you, Jennifer Lance. I'll send that over to you. It'll be very likely be online, web-based, but certainly if you'd like to join in and hear what Kathy has to say for the community and the wonderful work that they're doing. And then last but not least, under updates, certainly the Reidsville Police Department post-overdose response team, the PORT team there. I know that I've reached out to your county manager, Lance, and have made some comments about the good work that Chief Hassel and his staff there at Reidsville PD are doing. I just wanted to highlight as well and give kudos to county staff. You've got Lisa Ellington, you've got Jeff Pruitt, Justin Stewart, who are participating as well in that. And we're just right at about a month or so in operation. Data is being collected by the Reidsville PD, and our service providers are going out hands-on in follow-up, going with plainclothes officers and following up on overdoses in Reidsville area. And then just to let you know, and I forwarded that to Lance as well, was there is a city website that in connection with the PD that highlights what that post-overdose response team is doing. And I know that going forward, Chief Hassel very much so is, I think, looking forward to the potential of expanding what they're doing in Reidsville to the entire county at some point. So hopefully that'll be an opportunity that he'll be able to bring forward to you. I just wanted to just bring a brief highlight to you of the work that's going on there. For COVID-19 response and wellness, Cardinal's been very proactive in supporting our counties and members during the pandemic. As part of our efforts, we established a $1 million relief fund to assist stakeholders and community agencies to render much-needed services and support. The local agencies receiving financial awards were Cone Healthcare Connects, the Free Clinic of Rockingham County, Lot 2540 Inc., and the Salvation Army. And although the wellness activities at our physical sites have been temporarily suspended, our wellness center sites have been restricted, and employees and visitors aren't going to those sites currently to access wellness program. We do have various media portals that we've been providing wellness programming through, online classes, as well as tips for individuals looking to stay healthy, both physically and emotionally. During COVID-19, our local community operations staff have established outreach efforts to ensure that our members are continue productive daily living. We have quite a few. I know I've listed here the homeless shelters, group homes, and healthcare providers. We have quite a few group homes for supporting persons with intellectual and developmental disabilities. They come to our wellness centers for group activities, and I know right now is a really hard time to try and get groups together within close proximity to do that. And so we've been doing some outreach. We've taken some activity books as well as some baskets and things to those sites to try to continue to support those individuals. We've also tried to present them with some faces of people that they're familiar with at Cardinal, working with, to be able to see those individuals as well. But I've also included a couple of websites there, web addresses for you to look at all the updates and information that's available regarding COVID-19 and our efforts. We also include notifications as well as information from the state. And then the child welfare initiatives. So the foster care pilot continues to develop and progress with all partners. That would be your DSS, Cardinal Innovations, Department of Health and Human Services, UNCG, and the division to utilize Governor's Task Force funds for development of success teams and provision of high-fidelity wraparound services. The DSS partners participating are Cabarrus, Forsyth, and Rockingham counties. Ms. Farrell and her staff have been very involved. The state is currently in the process of developing a specialized Medicaid plan for addressing the needs of children and youth in foster care. There's potential that outcomes from this foster care pilot could result in consideration of recognizing collaborative efforts in the statewide plan. And I know that there are multiple areas, and I'll mention a few that aren't on your slide, but just mention a few areas that the foster care pilot is intending to address to decrease entry into foster care, decrease DSS and Child Protective Services recurrence, increase access to trauma assessments, which would probably be the primary goal, is to children ages 4 through 17 have an opportunity to receive a trauma assessment, which would also allow DSS partners and support individuals, which would potentially be kin and natural family, to also know potentially how to better interface and treat service providers to treat these kids that are in care, and develop a trauma checklist for parents to use in order to understand some of the signs, symptoms of trauma, and to be able to better interface and work with their loved one. And then also, Rockingham DSS is involved with both of these programs, initiatives, is participating in a standardized assessment process, which is a joint effort with Benchmarks, Cardinal, and then we also have Stokes DSS, who's involved as well, for providing children and adolescents in care with trauma assessments intended to ensure an appropriate diagnosis, leading to proper service provisions with the goal of improving child and family outcomes. And this process actually is scheduled to go live September 1st. So I know that Ms. Farrell and her staff have been involved, as well as Stokes DSS and Benchmarks, on getting trained and up to speed on that standardized assessment process and working with service providers to render those. Very excited about that, knowing that even though funding isn't available through the state currently, as far as through a Senate bill, that we have been able to partner with Department of Health and Human Services and the division to be able to continue that work through the Governor's Task Force funds. So that's the information I have for you tonight. If you have any questions, comments, I'm available to take those.
Thank you, Mr. Thornburg, for coming with an update. I got a couple questions I guess I want to throw at you,
Okay.
just see if you know.
All right. I know a few things. I won't
For one, let me ask you this, because you mentioned the local community council. Are you telling me that it's doing nothing because we don't have enough recruitment?
Currently, the Regional Health Council goes forward, but the Community Advisory Council currently has not been organized or has had an initial meeting because of the need
And
for
we've been
additional
working on this how long?
At least for the past 6 months.
6 months, and we can't even get organized to put people on that board.
Well, we had individuals identified. The recommendation came back for looking at local municipality representatives, law enforcement, to first responders to participate. There's been some outreach. We can't force individuals, obviously, to attend or participate, but certainly willing to reach out to any recommendations for serving. So that's why I've got Mr. Jones's information on there to be able to forward as well.
Maybe we can get you to go to city manager meeting, the county manager meeting, and talk to the city managers directly so we can get more people involved, because we need that committee up and going. Am I right? Huh? I don't know. How many you looking for?
Currently, I don't know. We've got a few in hand. I think we're looking at least probably a dozen or so, at least representatives. What we're trying to avoid is having the majority of those representatives, I think, be from service providers. We want a good array, a wide array of representation within the counties.
How about give me a list of what you're looking for, what type of representation you want, and give it to Lance, and maybe we might, as a board here, know some people that might be willing to do it.
Will do.
Other problem I'm having is, do you know what our ranking is in Rockingham County on opioid use?
Currently, I do not.
Do you know how many overdoses in this county we've had so far this year?
I can't say without looking at
Do you
doing
know how many
research.
Narcan pens we've used in this county for the last year?
I would say probably enough to where you've had to order more and financially have had to spend out.
Yeah, to me, that's a big issue. And I feel like Cardinal's been lacking in our opioid abuse pandemic in this county. Because if you look at the other counties compared to us, we're ranked higher than them. And we got a major problem going on here, and I really feel like Cardinal has not stepped up to the plate to help this county out on this opioid issue. We've been talking about it up on this board for years, and we keep getting promises that y'all are going to help us. And the only thing I got was some Narcan pens sent to the EMS. That's all I've got. We've been talking to you about detox facilities. We've been talking to you about treatment facilities, and we have yet to get anything. We had to go out and get an outside group to come in just to do a treatment facility. So I'm kind of disappointed in Cardinal with that aspect. Now, everything else, foster care, I'm okay with. It's the opioid problem. That's one of your areas to help us with, and I don't feel like we're getting much help. I feel like Forsyth County probably gets a whole lot more help than we do, and we got a higher rate than they do. So what, you see what I'm saying? You go where the rate is. That's all I'm asking. I'm just asking for some more help from Cardinal on our, I call it a pandemic. We got a major problem going on in this county with opioid abuse. I mean, you just look at the number of Narcan pens we use on a weekly basis. We got a major problem, and I wish Cardinal would help us with it.
And I know that Chief Hassel there in Reidsville would concur as well.
Yeah, we got a major problem, and I just wish we could get this local community council set up. Let's get some people going. Let's find out some solutions. 6 months to me is ridiculous. When Reidsville can do something called Port, and here we are as a whole county still sitting still, not doing nothing. Only Reidsville's providing that. Right. Nobody else.
Can I use you as a reference point to
Yeah,
follow
sure.
up with? Thank you.
Tell them to call
Thank
me.
you. Thank you. Thank you.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Reed, on your Triad Community Advisory Council, is it your goal to try to have one set up in each county operation?
Yes, community advisory councils are per county, yes.
Would that be somewhat similar to our mental health focus group meetings that we were having at the Wellness Center?
The community partners.
Yeah, with those community partners, some of those.
Yes, similar. Although the representation, typically during the community partners meetings, you could have anywhere from 10 to 30, representatives, different representatives. And the majority of those were service providers.
Yeah.
But we are looking for a greater variety.
Yeah, I think it's kind
of.
of migrated to the service providers, and I hope that one of these is you reach out maybe to Jeff Pruitt to get him to sit on this
Yeah.
advisory council, and encourage you to continue to be a participant with our opioid task force that we have in the county.
Yep.
And my next question, Jeff, Reed, is who is the best point of contact when we have an issue with Cardinal? Who's your problem solver? When we have an issue here with this in the county with with the services or service breakdown or a gap in the services of what we feel like should be and what is provided, who's our point of contact? Who do we go to that has the authority at 10 o'clock on Saturday night to resolve the issue and make sure that the consumer is taken care of? Who is that person?
Well, certainly 24/7, 365 is our access line, which is staffed with clinicians. But as far as a conduit for.
That's what I'm after.
Conduit for being able to steer to the right person or the right direction internally, that would be me.
Okay. All right.
Now, I'm not.
Well, who'd you do that? Sunday night?
Well, I'm not clinical. I'm not clinical in nature in terms of being able to render a clinical decision regarding care, but certainly being able to connect to internal departments, internal representatives, certainly our care coordinators. If you find that there's a case or an incident where there's a care coordinator involved, they are on call. They are accessible. Should be accessible. If not,
And I say that, Reed, because I know that there were times where that I had issues. And there was, and I know that those still continue, because we're working in a system that is far from perfect, and that there's needs to be someone that with Cardinal that is that can be that conduit to a solution to make sure that consumer is able to get the services that they should have. And if you say that person, you're that person, thank you very much.
well, and I would say far from perfect is still no excuse,
No.
right, to make additional efforts to try and address the need. So,
Thank you.
yeah,
Thank you.
thank you.
I've got a few. Read, just out of curiosity, this is kind of the bottom line. How much money does Cardinal spend on per capita in this county? Yeah, how
Per
much
capita,
money are you giving us? We want our share of the Cardinal money. How much did we?
How much money are we giving you?
Yep. How much are you spending?
As it
how
relates to
much
services? Yeah. As it relates to services?
Yes.
I can follow up and get you some information.
Yeah, I'd like to know that figure, total and per capita.
So how much is spent both Medicaid and state dollars for service delivery? Is that?
The things that Cardinal writes a check for, all the Cardinal monies that come to Rockingham County, I'd be curious in that percentage.
It's pretty big.
I know it's a big figure, but when, I'm heavily involved with Cardinal on the Commissioner's Advisory Team, but if somebody were to ask me that, and that would seem a basic sort of piece of information, and citizens, well, what does Cardinal do for me? And I can talk to them conceptually and theoretically, but I'd like to give them some hard numbers. Sure. Last month we did X, and this cost us so-and-so. In regards to your quarterly regional health meetings there, they used to be in Winston-Salem. I used to attend those, but I guess they're virtual now?
The regional health, the board meetings or the regional health council meetings?
Regional health council meetings.
So the regional health council meetings, we had one in person, COVID-19,
right,
and now they're virtual. Now they're online.
Are they not open to the public?
They are.
I'm thinking that might be a vehicle to get interested parties aware of what's going on.
Right, and the community advisory councils as well. That's the same format.
Okay. Gentlemen, other questions, comments? Once again, Reed, we certainly appreciate you driving up here.
Thanks for reaching out to me.
Be
Thank you.
safe and
Thank you.
on your way
Yeah.
back. Well, we like to see you about once a quarter as well, if we
Absolutely.
continue to work
Thank you,
that.
Reed.
Absolutely, thank you. And I'll follow up, Craig, follow up with you.
Appreciate
And get some information back for you.
Thank
Yep,
you.
Thank you.
Appreciate that. Thank you very much. We've deferred item 11, new business. New business today has to do with monies, care monies and HAVA monies. I'll ask representatives from our staff on at elections and our Board of Elections, if you'd come forward.
Mr. Chairman, members of the board, we were asked to provide you with a proposed plan for spending of these funds, which we have done. I believe they were provided for you in your packets. And if you have questions about any of the items, we certainly will be happy to answer them. As you well know, these are estimates. We have no way to know exactly what the cost of this election is going to be. We did find out today that any of the HAVA money that is unspent or unencumbered will remain in a HAVA account with the State Board of Elections if it is not spent or unencumbered by June 30th, 2021. Any of the CARES money that is unspent or unencumbered before December the 31st will be returned to the federal government. So as I said earlier, we have no idea what the exact cost of this is going to be, but I can tell you that office is really busy down there. I went back, just for your information, and looked at the early voting schedule for the 2016 election. We voted early voting 214 hours. For the 2020 election, the statute says we will be voting 610 hours, which is quite a difference. Our board was not unanimous in the plan for early voting. It split down party lines, so therefore it will be referred to the State Board of Elections for their decision, and that will be heard August 31st. So at this time, we know the dates, the span of time, we just don't know the exact days. I also wanted to let you know that in the 2016 election, we processed 1,419 requests for absentee ballots. As of today, the office has already processed 1,136. They have returned 100 of these requests back to the people who submitted them because they were not complete. And they also have a stack down there that they have not actually processed yet. So this is a very busy time for that office. I wanted to also tell you that, I meant to mention this a second ago, I want you to know that we do try, when purchasing this equipment for this election, we try whenever possible to use local vendors. We want to do that to try to keep the economy going here in the county. So if any of you, since all of you are businessmen, have any suggestions about vendors we can use for any of the items that we have presented to you on our request, we certainly would be more than happy to contact them. I'm trying to think if there's any. One other thing I wanted to bring to your attention. We have started locking the door at the elections office. Part of it is for safety reasons, and the other part is for virus reasons. There's a bell down there that anybody that wants to come in can ring. They're required to have on a mask, and we just feel like for the time being that is the safest thing to do for the staff. Do any of you have any questions you'd like that we could possibly answer?
Yeah.
I've
Questions?
got a couple.
Go ahead, please.
I guess tonight you're just asking for approval for the financial part of this.
Yes.
That does not require a local match. And was that unanimous in approval?
Yes, it was.
Okay. Then you mentioned the absentee ballots, which just, I guess, incomplete and poorly completed ballots, absentee requests that are coming in. Are they coming in from individuals or from groups? And I ask that because one of my roles as an attorney is as public guardian. And we get all kinds of mail for folks once we're appointed as their guardian. And oftentimes that continues for years. And at my office, we've received 3 solicitations to dead people from a group that is heavily affiliated with one particular party. So once you mention those absentee ballots and they're be poorly completed, it just kind of throws some red flags in my mind, just as those solicitations come into my office for those dead folks do. So do you have any information on that?
I'm going to let Amy address that since she sees these come in, actually.
There are advocacy groups that send out absentee request notices to people. Where they get their list of names, I'm not sure. But the absentee requests that are mailed in, they are from individuals. And we have to go through a process when these forms come in. We have to scan them in the system, and we have to link them to voters. So we are checking the signatures to make sure they match. You know, granted, over time, elderly people's signature changes a little bit, but we're doing the best we can to make sure everything's legitimate.
And I think there's some rules about the requests being pre-populated.
Exactly.
Okay.
If they're pre-populated, now people can go online and type in the information that way and then sign it. But if it has like someone's name, and no address or anything like that, we deny those. We send them a letter, and we send an absentee request form that is legitimate, and let them know that the one that they sent in was not legitimate, and if they would like to use the one we send there, they can.
And I do want to point out that the ones that, or the solicitations to the deceased at my office, the folks have been dead for years. As far as your budget, I'm assuming that y'all are looking internally for filling any holes that may be needed financially. In other words, you're mentioning you don't know how much it may cost.
Right.
I certainly hope that y'all are tightening the belt in certain areas or some areas
Yes.
so that y'all can cover any of those additional
Yes,
expenses.
definitely.
Okay.
We don't, hopefully, we won't have to ask you for any more money. That's our goal.
Right.
But I will say this, we're pretty excited about this. You know, a couple of meetings ago, I'm not sure exactly which one, but the security system that we requested was denied by the county. And these HAVA funds are going to purchase that for us, so we're pretty excited about that.
Good. And I think I learned since that meeting that that'll help reduce the number of folks you have in the office at a given time.
Yes,
Okay.
definitely.
I don't believe that was shared with us when that was presented to us.
Okay, but that is the case.
Thank you.
But that's all I have, and certainly we appreciate all that you guys do. I know it's a full-time job being a county commissioner, but we do respectfully submit this request to you and ask for your approval.
Commissioner Travis?
Yeah, Tony, thank you. This might be for Amy, but
Okay?
I'm glad Kevin brought up dead people voting. And, I got a couple phone calls, people complaining about it, and I reached out to the Board of Elections. So I want you to explain to the public what goes on every year to make sure you purge your system. So
We purge our voter registration list daily, weekly, monthly, semi-yearly, and yearly. If someone hasn't voted in 2 federal elections, then the state board automatically removes those people. When people die in Rockingham County, the Register of Deeds office is really good about sending us a list of those that are deceased, and we go in and we remove those people. The state has lists that we go and check with them. We have a form on our website for relatives to mail in when a family member dies. One of the problems is if someone lives in Rockingham County and they have to go to the hospital in Guilford County, and they pass away in Guilford County, then we have no way of knowing unless they send that that death notice into us, because the Register of Deeds has only the people that die in Rockingham County.
So it sounds like something we need to start reaching out to the other hospitals in the other counties to make sure nobody from our county's on their list.
But you did mention Register of Deeds since I said it.
Yeah, they send us a list each, but the people on the Register of Deeds list, they are the ones that die in Rockingham County. If you live in Rockingham County and you have to go to the hospital in Guilford County, and you pass away there, you will not be on that list. You will be on Guilford County's list.
I didn't know that.
Oh,
Thank you, Mr. Chairman. Thank
Okay.
you.
I had a question.
Go ahead.
Tony,
Yes.
you kind of got my attention when you shared with us that in 2016, we had approximately 214 hours of early voting.
Yes.
Do you know what that equated, cost-wise, what that number was?
I do not have that information, but I certainly will get it and email it to you.
And you shared with us that the Board of Elections could not decide upon a early voting schedule,
That's correct.
and that with the maximum length of early voting could be as much as 610 hours?
That's correct. Both plans submitted, and actually, we have copies of them. I didn't know if you wanted them or not, but we certainly have that available for you tonight. The plan, that vote has to be unanimous by our board, which it was not. The plan that was selected included a Sunday vote. And as I said earlier, the vote was split down party lines, and it will be going to the state for their approval or on August 31st.
How many people did you have vote when you
We
offered
had-
Sunday voting this last election?
3 voted for Sunday.
Thank you.
Wow.
So potentially, we could spend significantly much more money.
No, the money's going to be the same because it's the same number of hours. The plan that our board selected just changed the days. When you get those, Plan C is the plan that the majority voted for.
Okay. All right.
Isn't that right? Yeah. Plan B was the minority vote.
Are you finished there, Commissioner Pearl?
Yes, sir.
You may not have this. I'm hoping Amy's got it committed to memory.
I'm just hoping somebody does.
Well, one of the figures that I like to see is how much does it cost per vote. And in 2016, with 215 hours, that number of hours and the amount that we had to pay those people should have been divisible by a number of voters. And do you know the number of people that voted early in 2016?
No, I don't have that right offhand, Mark, but I certainly will get it together and get it to you
Okay.
and the other board members if they'd
Well,
like to have it.
I suspected as much. I've asked that question about 3 times and never gotten an answer.
I remember you asking somebody that, but we'll get it.
But if we spend 600 hours versus 214 hours, I would assume the cost of each individual vote, if you had the same number of voters, would be 3 times what it was in 2016. Was this brought up before the board as they considered the methodology? I realize you had to have some sort of Parvo 16.
I don't recall that being brought up before, but I will tell you, I was not going to mention this, but I will. I just checked today when I was down there. We actually had more registered voters in 2016 than we do now.
Are they bailing out?
I don't.
Okay.
But we'll get that information for you.
You're going to find that this board is really good at spending somebody else's money.
Which board? Your board or
This board,
ours?
no, this one here. No, you're going to actually spend it, but we're going to authorize you to, or at least we're going to ask the question. Other questions concerning the election and the use of CARES and HAVA funds?
Mr. Chairman,
Yes, sir.
on this Plan B, if you could, on October 17th, that Saturday,
Right.
is that 6 p.m.? Should that be 6 p.m.?
Oh, it should be. Thank you for catching that. It's just a little typo.
I was looking for the other hour. Thank you.
Thank you.
Other questions from the board? Commissioners, we need a motion to approve or disapprove.
I'll make a motion for approval.
Motion to approve by Commissioner Travis
Second.
and seconded by Commissioner Hall. Further discussion, questions, comments? Hearing none. All in favor indicate by saying aye. Aye. Those opposed by nay.
Thank you, gentlemen.
Good luck. Listen, if it sounds like you're getting grilled, I think it's representative of a level of ignorance that we have and trying to be responsible with public monies. And I think all of us totally appreciate the difficulties, the challenges with this Corona-19 virus that you're going to have, plus some other indications. I'd also ask that you would share with your chairman, Mr. Richardson, the sympathies of this board in regard to the loss of his daughter-in-law.
I will. Thank you.
Thank you.
Thank y'all.
Mr. Manager, any other new items? That being said, let's move to commissioner comments. And Mr. Travis, would you care to start us off?
Thank you, Mr. Chairman. I just want to tell everybody in the audience, thanks for showing up and listen to the meeting. If you get a chance, visit your local stores. If you got some great things happening in Rockland County. You got a lot of tubing going on in Madison, so if you need to get out and get into nature, I recommend go tubing down the river. We did it this past weekend. Great time. So shop Rockingham County, and let's keep sales tax dollars here. Thank you.
Thank you. Commissioner Berger.
Yes. Well, today was the first day of school, and DPI was certainly not prepared, which probably doesn't surprise very many people. We were excited to see buses back on the road. We do have one public school that was in person, and hopefully in the near future we'll have more. Thank you.
Thank you, sir.
That was awesome.
Commissioner Pirtle.
Thank you, Mr. Chairman. Appreciate everyone coming out tonight. I want to again congratulate Mr. Taylor, Mr. Dooley, and Ms. Seaver for making all those masks and their effort that went into to doing such a kind thing. And last, I just want to touch base and say it was great to have Ann Fish recognized as our outstanding volunteer. Ann's been a fixture in this community for quite some time. She's probably written about either one of us or somebody we know at some point in time during her tenure in with the media. But we're very fortunate to have her in Rockingham County, and again, thank her for everything that she does. That's all I have, Mr. Chairman.
Yeah. Thank you, sir. Commissioner Hall.
Thank you, Mr. Chairman. Again, I'd like to appreciate everyone for attending tonight. We always love to see folks here. Really didn't appreciate how much until nobody was here, and that was kind of an eerie time. But so we appreciate you folks who did come, and I'd again like to point out specifically Ms. Fish. Thank you for being here tonight. We enjoyed seeing you. I'd like to point out Doug Isley is here from our Rockingham County Board of Education. Thank you for being in attendance, as well as we all saw Tony Reese, and we have Bonnie Ferguson as well from our Board of Elections. Thank you, ladies, for being here. I'd like to say thanks to Sheriff Sam Page for having his staff here tonight during our meetings. We appreciate you guys being here. Thank you, Mr. Chair.
Thank you very much. I too congratulate yet again our Volunteer of the Month and the folks that we recognize for their contribution. And I'd point out at this time that we are always looking to recognize outstanding citizens. So if you have a suggestion for a Volunteer of the Month, you can contact our clerk to the board. Jennifer Woods would be glad to help you, or you can speak to any one of us commissioners, and we'll be glad to get that recommendation in the right place. I'd like to mention that I guess this is a good goodbye, but this month we lost Heather Adams as the head of our Partnership for Children in this county, and she's served us diligently, I believe, for 16 years, if I'm not, but a significant amount of time, and has made notable contributions during that time. And she's hasn't moved. She still lives in northern part of Guilford County and has a position in Guilford County. But we appreciate all that she did for our county. So I'd also like to make a plea for safety. A couple drownings this past week, once in a lake and one in the Dan River, and one saved also out of the Dan River. So we want you to go out and enjoy our recreation facilities, but do it safely. Be aware of the problems with heat exhaustion as well as potential for falls or drowning. And I think that requires that we all be vigilant for our very young citizens and our very elderly citizens, that we keep that in mind during this tough weather. Gentlemen, do we have any other business that needs to be covered in public? Hearing none, we have a closed session required. I don't think there's any need to take action in public session after that is over. Unless there's more business to be conducted now in the public, we would accept a motion to go into closed session pursuant to the appropriate statutes.
Mr. Chairman, I make a motion we go into closed session pursuant to the 143, 318, 11, A1, A3, A4, A5, and A6.
Motion to go into closed. Do I have a second? Second by Commissioner Pirtle. All in favor indicate by saying aye.
Aye.
Those opposed by nay. Thanks again.